maintain key behaviours that reduce risk of transmission, key public health measures that reduce the risk of transmission without disrupting normal life to the extent to which we've had that disruption over the last year and a half. So I would say, and I'm not going to comment on specific circumstances, but I would ask governments, we would ask governments, to be really careful at this moment, not to lose the gains you've made, to open up very carefully. We've seen over the last 6 months, case after case, country after country, in which there was a lot of increase in social mixing without adequate vaccine coverage, and we've seen wave after wave of cases. I would hope that in the European environment we won't see a return to the overwhelmed hospitals and the exhausted health workers. But that's not a given. This virus is evolving, this virus is changing, and we need to be very, very careful at this moment so that the gains that have been hard won by the behaviours and action of our population are sustained, and that we gain the benefit collectively of all of that effort. So individual behaviour and government support to that behaviour extremely important, and I would urge extreme caution in the complete lifting of public health and social measures at this time, because there are consequences for that.
Thanks to Dr. Van Kerkhove and Dr. Ryan. Let's move to the next question. We have Indonesian service of Voice of America, Yuni Salim. Yuni, if you could unmute yourself, please.
Thank you. My question is regarding the treatment. Is there any update on WHO policy on the clinical trial of the use of ivermectin for COVID treatment, which is being widely used in Indonesia and other countries because of the spike of infection? And how long the clinical trial lasts, and what is needed so WHO can make a statement to be used as part, it's okay to be used as part of the treatment?
Thank you very much, Yuni. The line wasn't the best, but I think we got a question. It's about ivermectin and trials around these treatments. We have Janet Diaz online, who is leading on clinical aspects of COVID-19. Janet, would you please address this question?
Thank you, and thank you for the very important question. So just to also acknowledge that that we recently, as DG nicely shared with you, updated our clinical guidance. So we did have a strong recommendation for the use of IL-6 receptor blockers in patients with severe and critical COVID-19 for both life-saving, reducing mortality and reducing the need for invasive mechanical ventilation when used on top of corticosteroids. And I think that's a really important advancement in our clinical management guidelines. And I just wanted to take this opportunity to emphasize that again, and to thank all those that participated in the trials, the trialists, and the patients and their families. In regards to ivermectin, we are continuously looking at the data for ivermectin. We have a living systematic review that reviews new publications and incorporates that into our meta-analysis, which is the way that we bring in study trial results from different studies around the world into one evidence synthesis in order to understand, is there a benefit or is there not? Since our last update on ivermectin, we continue to have the same recommendation, which is only to use ivermectin in the context of clinical trials. That was based on a very low certainty of evidence when we did our meta-analysis. And just to kind of highlight, the numbers of patients that were enrolled that actually had mortality data or need for mechanical ventilation data, there are low numbers: 1,419 patients for mortality, 687 for need for invasive ventilation. So meaning that we just needed more trials, which is why we wrote that that recommendation. It's kind of a special recommendation to really encourage to wait for more trial data in order to refine and update that recommendation. So at this point, we have not updated it since that publication, which was at the end of March, but we are closely following the literature and will update when it's necessary. So thank you.
Thank you, Dr. Diaz, for this. Now we will move to the next question. John from Reuters. John Miller from Reuters. John, please.
Thank you for taking my question. It sounds like you're sharpening your tone a bit with countries that have held large events, particularly in your remarks to open the meeting today. And I'm wondering, do you think that we will look back on the Copa America and the Euro with regret because cases will rise in those countries that held the events after they're over? Thanks very much.
Thanks, John. If you think that was a sharp tone, you don't know me. I think what we've been trying to continually reinforce, no matter what the setting, whether the setting is a normal situation in country and government policy, whether it's managing schools, whether it's managing mass gathering events, is taking a risk management approach. Knowing the risks, knowing the local epidemiology, trying to reduce the risk of transmission to the lowest possible level in the circumstance, and ensuring that the activity that's been undertaken, whether that's a school activity or something else, is prioritised by everybody as being something that's necessary, if something that should go ahead and that has social, cultural and other value, then you work so hard to try and reduce those risks. So we're not sharpening our tone. What we're saying is, please stick to the plan. Risk management hasn't been perfect in this pandemic, but it has saved a lot of lives. It has slowed down the pandemic at key times. It has kept the pressure off the health system. It has allowed health workers and others to save many more lives by doing that. And with vaccination, our hope was, and still is, that with vaccination, that we would take the pain, the tragedy and the suffering out of the pandemic. We're not there yet. And that's what we're saying. We're not there yet. We need to stick to the plan. So we need to be careful. It doesn't matter what the event is. And in terms of gathering events and looking back, I'm sure many people will look back with many regrets. The real question when you look back on anything is whether or not you can reassure yourself that you understood risks, that you tried to manage and reduce those risks to zero, and when something happened, you reacted to that reality. I'm not going to comment on specific events or mass gatherings. What I would want to make sure is all of those individuals and countries and institutions planning events in the coming months, that due care and attention be paid to managing the risks associated with that. It's exactly the same to opening schools, opening universities, managing social life. Moving forward, we need to ensure that social engagements where people come together, that we assess the risks, we inform people, and we manage and reduce those risks to as close to zero as possible, and we're able to prioritise which of those events and which of those social gatherings are necessary, are valuable to our society. And I think we've done, I think overall, there's been a huge collaboration around the world in many institutions, organising virtual events, scale-back events, no spectator events, and gradually and learning more and more about how to manage those risks associated with sports and other gatherings. And we're seeing a tremendous amount of new knowledge being generated and new techniques and new approaches. We would just like to see all of that knowledge approach used, so that as we move forward now over the coming 6 months or a year, that we apply all of that learning around mass gathering events, around all of that, so we absolutely do whatever we can to reduce the risk of transmission associated with those events. Maria?
Yep, thanks. I can attest that if you thought that was Mike being sharp, then you don't know him very well. But I think we've been very blunt. I think we try to speak openly, honestly, with humility, but we need to be blunt when we need to be blunt. The global situation is we're not in a good place. The DG has said it many times. Every time he speaks, we're not in a good place. In Africa, there was a 16.7% increase in cases in the last 7 days. There was an 16.4% increase in the Eastern Mediterranean region, a 33% increase in cases across Europe, an 8.6% increase in Southeast Asia, a 10% increase in the Western Pacific. The only region that had a decline in cases was the Americas. But if you break that down by country, there are more than, I counted again this morning, there are more than 24 countries that have epidemic curves that are almost vertical right now, almost vertical. This is not the situation we should be in when we have tools at hand. There are 4 major factors that are driving transmission. One is the virus itself. This is a dangerous virus to begin with. Now we have these virus variants that have increased transmissibility. The Delta variant is now detected in 104 countries, the Alpha variant in 173 countries, the Beta variant in 122 countries, and the Gamma variant in 74. Some countries have all 4 of these variants of concern circulating. The Delta variant has increased transmissibility, even more increased transmissibility than the Alpha variant. If that virus takes hold, it will spread. The second factor is mixing. So you mentioned some specific events. We know that the social mixing, the social mobility of people is increasing around the world. These are small gatherings, whether these are at somebody's home and you have other families that are coming together, perhaps indoors, maybe not outdoors, maybe you don't have the right restrictions in place or interventions in place like distancing or masks, for example, or large events. We know that these events around the world, whether they're sporting events or the associated side events, the fan zones that you see of people outside, religious events, religious gatherings, many different types of gatherings, whether they are spontaneous protests, for example, or not, drive transmission because you bring people together if the right interventions are not in place. The third factor is reduced use, inappropriate use of public health and social measures. The use of these measures does not mean lockdown. Public health and social measures is not lockdown. It's a combination of interventions at the individual level to the community level, and it covers everything from wearing of masks, physical distancing, avoiding the three C's, these crowded indoor spaces, spending more time outdoors than indoors, improving ventilation, keeping your hands clean, et cetera, et cetera. The last factor that's challenging us right now is the inequitable and uneven distribution of vaccines. And you've heard us talk about this over and over again. The world, large parts of the world remain susceptible to infection. If you have variants of concern that are circulating, if you have increased social mobility and social mixing, if you have the inappropriate use of public health and social measures, and you have a very susceptible population, the virus will thrive. The virus is showing us right now that it's thriving. This is not theoretical. We're not talking about a what-if situation right now. We're not talking about preparing for a surge. It's happening now. So what are we learning? The question was about regrets. The question should be, what should we do now in taking all of the knowledge that we have? We have the upper hand here. The virus is mutating. It's changing. Even the Delta variant itself is mutating, and it will continue to do so. We still have the upper hand. Let's use the tools that we have to keep transmission down, drive down transmission, and really be smart. Play it safe, be smart, do what we can at individual level measures, have really strong policies that are agile, that adapt to the local situation, and we all really need to play our part here and do what we can to drive this transmission down. The virus has a hold over us right now, and we need to regain control over this virus.
Thank you very much. We have 10 minutes left, so let's try to take a few more questions. We have Naomi Grimley from BBC. Naomi, please unmute yourself.
Ask Dr. Ryan another question about the UK change of policy, because I think it's been watched around the world. Part of the government's reasoning, they say, is that if they have an exit wave now in August, it's better than having one later in September. So they're gambling on cases going up sharply and then falling back down pretty sharply. Could you just explain to me a bit more about whether you think that's too hopeful, or whether that there is some good grounds to believe that will work?
Thanks for the question. I'm not aware that that's the logic driving our colleagues in the United Kingdom. I suspect it's not. I would like to verify that that's the logic, but the logic of more people being infected is better is, I think, logic that has proven its moral emptiness and its epidemiological stupidity previously.
Thank you very much. Catherine Fiancan-Bokonga, our colleague from Geneva Press Corps, working for France 24 and some other outlets.
Thank you so much. My question is related to the summer. As Mike and Maria said, with summer, countries are opening up widely to vaccinated people, but differences are made between the people that are vaccinated with WHO-approved COVID-19 vaccines, the one that are approved by the European Medicine Agency. And now we also see a difference made between the AstraZeneca produced in India or in other sites, and even people vaccinated, I mean, that the injection has been made in Africa or Europe. And Sputnik often is considered as not, people vaccinated by Sputnik are considered as not vaccinated. So I would like to have your position on that. Aren't vaccines that are recognized by WHO and the other EMA official vaccines, in quotes?
Thank you, Katrin.
What is that discrimination between kind of vaccines or the place you've been injected with it, with the doses?
Thank you, Katrin.
Thank you, Catherine. Let me start by saying that the European vaccine certificate is aiming at facilitating the transit of people who are resident in Europe or are national from the different European Union countries, right? And and then the regulation, the conditional market approval for vaccines in Europe is done by the European Medicines Agency. That's one fact, right? The EU resolution, the recommendation is strongly recommending for entering the Schengen space that countries accept vaccinations that were done that were approved by WHO through the emergency use listing. And that includes the AstraZeneca vaccine that's being produced in the Serum Institute of India. Sputnik vaccine is still being assessed by WHO. It hasn't been emergency use listed, although it's authorized, I think, in 2 countries in Europe. But WHO is still assessing the dossier and has done inspections in Russia and the manufacturer. So this process is not finalized yet. So this vaccine is yet to be listed by WHO. Now, we are, of course, in conversations with the European Union, and we are also working with the different member states in their the internal policies they are adopting for entrance into the Schengen space, which is that the recommendations that they use WHO emergency use listing. And let me say that this is a new name that we're using during this pandemic, but it's a procedure that's from the pre-qualification of vaccines program, which is one program that WHO does for many, many years, since the 1980s, and uses very stringent international recognized standards for the quality of the manufacturing, quality assurance of the vaccine, for safety and the efficacy of the vaccine. So this is a very solid process, and that's why we believe it's promising that individual countries in the Schengen space will approve the entry of people who have been vaccinated with WHO-approved vaccines. Thank you.
Thank you, Dr. Simao. We have time for one, potentially 2 questions. So let's go to Bloomberg. Corinne, can you please ask your question?
Thank you. I was just wondering if you can give an update on what the latest is in any new inquiry into the coronavirus origins. I know a while ago, the WHO was having informal consultations with member states about the next phase. So any idea yet what the next steps might be?
Thank you. No, we continue to consult with our member states quite intensively and are putting together the framework for moving forward with this whole endeavour, with a view to a short, medium and long-term approach to studying the origins of this virus, but also a broader framework for studying the origins for all viruses in future. I think what we are learning in this process is that we need stronger frameworks to do this work in general, and we're working to both deal with this immediate issue of the origins of SARS-CoV-2, but also put in place a reliable, transparent, open and collaborative framework for doing this work now and into the future. Forgive us as we do this very carefully in trying to bring all of the best minds together to get ourselves both a solution for now and for the long term. And again, thank you all for creating the space in which we can progress the science and our knowledge in the absence of politics.
In the absence of politics. Thank you very much, Dr. Ryan. Last question for Maya Plant's Geneva-based correspondent. Maya?
Thank you very much. My question is regarding the measures that are being taken now in the UK. What is the opinion of the experts at the WHO regarding this trial that they're making?
Maya, I'm not sure we understood your question. Can you just repeat your question, please?
There are some new measures now in the United Kingdom that are taking place, like lifting restrictions, going for some sort of herd immunity.
Maya, this question has been answered, but Mike will repeat.
No, just again, I honestly don't believe that that's the intention of the United Kingdom. We'll certainly follow up with them. Every country right now is lifting restrictions in one way or the other. All countries are trying to reach a balance of measures that allow their societies to open up, allow activities to return to something resembling normal, while trying to maintain an element of control over the virus while trying to increase vaccination. Maria's made the points before extremely well. We have to be very cautious, we have to be very careful, we have to be ready to step forward, but we also have to be ready to step back. So we know, for example, that the United Kingdom has very high rates and have achieved great success in vaccination. Part of the dividend for that is supposed to be a more opening up of society. But at this point, and our point has been, and I'm sure it's in the consideration of the excellent scientists and the excellent professionals who advise and manage the UK public health system, that they are also very aware, very alert to the threat represented by variants, especially the Delta variant, are going to open up very cautiously and will be ready to adjust that opening up according to the epidemiology. And I think that's what we need to do. We need to manage this by looking at the data, looking at the virus, knowing where the virus is. If the virus, and we've said this for Europe, Maria laid out 33% increase in cases in Europe in a week. Clearly, we need a note of caution on how we do things. We need to move forward very carefully and with options to be able to step back if we find that that process results in a negative consequence or an unintended outcome that's bad for our populations. What we're saying in particular is that countries opening up who have very low levels of vaccine coverage in the presence of variants is a real toxic mixture for your hospitals filling up again, and this is something that must absolutely be avoided. But again, I would say we have many very good colleagues in the United Kingdom, and I don't honestly believe that they would be. They're obviously trying to use vaccination to get to some level of herd immunity. That's a totally laudable objective. But the idea of allowing people to be infected in order to achieve that, I think, is something that the UK has made it very clear in the past that that's not part of its core strategy in responding to COVID, and neither is it for any other country I'm aware of at the moment.
Thank you, Dr. Ryan. And Maya, maybe you want to listen to what has been said previously during this press briefing when there was more being developed on this question. With this, we will have to close this press conference. We will send an audio file a little bit later, and the transcript will be posted tomorrow morning. Final word for Dr. Tedros.
Yeah, thank you, Tariq, and I would like to thank all the media colleagues who have joined us today. Thank you for joining us, and see you in our upcoming presser. Thank you.